So vitamin D is one of the most commonly talked about supplements. We've all heard about it and probably taken vitamin D supplements at one point in our life. But there are three important questions which everybody needs to know. The first question is, how much vitamin D do we really need? Second question, what really happens if we don't get enough vitamin D? And the third question, and in my opinion the most important question, is what happens if we take too much of vitamin D? So to answer all these questions, you first need to know a little bit about vitamin D. So although vitamin D is called a vitamin, but it behaves more like a hormone. So vitamin D is produced in our skin when we get exposed to UVB rays which are present in sunlight. This is in turn modified in the livers and kidneys, and the product which is produced in the kidneys is called calcitriol, and this is the metabolically active form of vitamin D. This calcitriol acts on different tissues and it influences the genetic activity in those tissues. So when vitamin D is deficient, the intestines absorb less of calcium and phosphate. In kids, this can lead to something called rickets, whereas in adults, prolonged deficiency of vitamin D causes osteomalacia, which leads to weak bones and muscle pains. So what exactly counts as deficiency? To measure vitamin D, we conduct a blood test and measure something called as 25-hydroxy vitamin D. Deficiency is when the level comes out to be less than 12 nanogram per ml, whereas a level above 30 nanogram per ml is often taken as a sufficient level. However, there is no universally agreed blood level of vitamin D in which suddenly we will see some kind of benefit. So the levels need to be in the normal range. So how much vitamin D do you require every day? For adults between 19 and 70 years of age, the recommended dosage is around 700 international units per day. Whereas for elderly people above 70 years, the required dosage is around 800 international units per day. So this is the total amount of vitamin D required per day, be it from food, supplements or any other sources. It is not necessarily the amount you need to supplement every day. This is very important because vitamin D supplementation has become very aggressive. But there is a very important thing that you should know. Vitamin D is a fat soluble vitamin. So if you take excess vitamin D, this will get accumulated in your body. And this excess vitamin D can cause hypercalcemia, which might lead to a dangerous situation. So the practical approach is quite simple. Get your daily dose of vitamin D from dietary sources and from sunlight. If you have documented deficiency, you definitely need to go for supplements. But please consult a physician before starting the supplements because the duration and dosage of supplements will vary from person to person because the treatment needs to be individualized, not generalized. And I would like to add one final point. Although vitamin D is an important supplement, it is not a universal health supplement. As long as your vitamin D levels are in the normal range, you need not go for any kind of supplements. The goal is to have adequate levels of vitamin D while avoiding unnecessary supplementation. So I hope that you learned something new about vitamin D today. I will see you in the next video.